Hi, I'm Dr. Sue Mitchell, and I'm here today to review your labs to help give you some insight and help you kind of start reviewing the labs and what they mean prior to your visit. So on page 1, we're here with your cardiac section. And the first lab you see at the very top is called a cardiac CRP, or also an HS CRP, which means highly sensitive CRP. And this is a great test because it's a measure of inflammation in the blood. And there is an old test that's just called a CRP, that's a standard, but this is a special one that was developed by a cardiology clinic that is a much more sensitive assay. And so we're able to detect very small amounts of inflammation in the blood. So if you look at the panel here, you will see normal is less than 1. So if your number is less than 1, that is great. You'll see a yellow range, and we consider that moderate. That is between 1 and 3. And then high is a number that's over 3. And studies have shown that if your number is over 3, you have an increased risk of heart disease, vascular disease, and other types of inflammation. The CRP can also be elevated if you've recently had an infection, due to a recent illness. It's something that we really work hard to bring down, especially through diet, nutrition, optimizing your lifestyle. So the next section is the cardiac or the lipids section, and that's right below the highly sensitive CRP on page 1. So you'll see here a variety of different lipid numbers. In traditional medicine, the standard is to do cholesterol, triglycerides, HDL, LDL. But in this test, the Cleveland Heart Lab breaks it out into a lot more individualized lipids so we can really tell what's going on in terms of a cardiac risk factor. So the LDL is still here, but you will also see that there is an LDLP, and that stands for the particle number of LDL. So when you see LDL, that is a representation of how much cholesterol is being carried by LDL particles. I tell patients one way to think about the cardiac numbers is when we eat a meal and we have fat part of the meal. That fat comes into the small intestine, and obviously we break down fat, and that fat is transported to the liver where we make cholesterol. So you are able to tell on your cardiac labs what is your serum cholesterol. And so there are certain ranges that we like to keep the cholesterol, but more importantly, when the liver makes cholesterol and we need to transport cholesterol to the other organs in the body, and the way we transport cholesterol is we use what's called an LDL. It's a lipoprotein, and these little proteins, I call them cars. So think of an LDL as being a car, and the liver puts that cholesterol inside the car, and that LDL particle is transporting the cholesterol to the organ or to the cell that needs it. When you see your total LDL, that is how much cholesterol is in all the LDL cars on your highway, thinking about the blood vessels and artery as your highway. So an important thing with LDL is what's the total number. When it's elevated, obviously we want to bring that down, but more importantly, we can look in terms of LDLP, and that is how many cars are on your highway. So your liver, when it's deciding to package up that cholesterol, it's going to put it in the car, and sometimes the liver will produce lots of cars. You'll see high numbers of LDL particles. And then also when the liver is making these cars, sometimes it makes the cars really small, kind of like a Fiat, or it might make a bigger car, like a Cadillac. When the cars are really small, those are more inflammatory. So always think if you have lots of cars on your highway and the cars are really small, they're going to be more likely to bang into each other and more likely to bang into the side of your artery, which would cause damage and could possibly be the beginning of atherosclerosis. You will see LDLP, which is the number of cars, and LDL size. And we want the number of the small LDLs to be very low. So we will be looking at that when you come for your office visit. The other lipid number that's important is the triglyceride. I like triglycerides to be less than 100. When you see elevated triglycerides, that can definitely be triggered by diet, such as somebody that has a lot of sugars, a lot of corn syrups. So if your triglycerides are elevated, we'll definitely want to talk about dietary factors that might be contributing to it. The last lipid that we're all familiar with is what's called HDL. And we kind of think of HDL as the good cholesterol. Like that's the particle that's kind of bringing any unnecessary cholesterol that's out there. It's grabbing it up and bringing it back to the liver. We typically have thought lots of HDLs are good, but there is more data coming out that sometimes, specialized tests will look at the function of HDL. So in terms of where we want your lipids to be, Quest or Cleveland Heart, they give you ranges, but obviously we may want to get more aggressive control about your lipids, and this really is dependent on other inflammation numbers that we see, nutritional deficiencies, and most importantly, family history. If you have a family history of early onset vascular disease, heart attacks, strokes, we will want to be more aggressive in terms of really getting optimal control of lipids. We want to do diet supplements, but sometimes it may require even a low-dose statin prescription. That's just something we will discuss in your visit. We look at the lipids and definitely look at it in context with your family history, genetics, and all the other labs that you're getting as part of this panel. All right, so now we're on page 2 of your lab handout. And at the very top, I'm looking at apolipoprotein B. We also call it ApoB. This is a very good number to just track over time, as it really takes into account all the LDL particles. So it picks up other particles that the LDL doesn't. Some longevity doctors, like Dr. Peter Attia, think that following the ApoB is one of the best numbers to follow for longevity. The next lab test we have is called little a lipoprotein, or lipoprotein little a. And this is just a genetic type of little a protein. About 25% of the population may have it. I'm one of them. If you have it, it just means that you're making this very different type of lipoprotein. This little a, it gets stuck to my LDL cars. It makes my LDL cholesterol particles on my highway more likely to stick together. Right now, there are no approved medications for this, and so definitely trying to bring down your overall LDL is very important. Diet, lifestyle, exercise. It's very important to me that even though there aren't medications for this, that we use this as a screening tool, because if I find patients that have elevated little a lipoprotein, it's very important to make sure we do our cardiac prevention tests like a CT calcium score, maybe even doing what's called a CT angiogram, or even making sure we get a carotid ultrasound done to look for any atherosclerosis that may be beginning in your carotid arteries. There are other more detailed tests that are here as well, and we'll go through those in more detail at your visit if you have other questions.